Whether you or a loved one are dealing with diabetes or just interested in learning more about it, this video is for you. So, if you're ready to unlock the knowledge about oral diabetic medications, hit that subscribe button, give us a thumbs up, and let's get started.
Before discussing non-insulin medications, it's crucial to emphasize that for patients with severe hyperglycemia, including symptoms like polyuria, weight loss, or an A1C above 10%, it's advisable to consider insulin therapy instead. Insulin can effectively and swiftly lower blood glucose levels in these critical situations. For patients with asymptomatic hyperglycemia, starting with the oral medication metformin is recommended. Metformin is known to decrease gluconeogenesis, is weight neutral, and offers several advantages. It can reduce A1C by 1 to 2%. It is relatively inexpensive, making it a cost-effective choice. Metformin should be used cautiously and is contraindicated if the estimated GFR is below 30. If the estimated GFR is between 30 to 45%, give half the standard dose of metformin rather than the maximum dose of 2,000 milligrams per day. If the patient experiences gastrointestinal side effects like diarrhea, it's advisable to avoid discontinuing the medication altogether. Instead, you can consider titrating the dose slowly to find the optimal dose for the patient or using an extended-release form of metformin, which may be better tolerated in terms of gastrointestinal side effects. Choosing between an SGLT2 inhibitor and a GLP-1 agonist as an add-on therapy to metformin in the treatment of diabetes involves considering various factors, including patient preferences and clinical characteristics. Here are some key points to help guide this decision. One of the initial deciding factors is whether the patient prefers an oral medication, such as an SGLT2 inhibitor, or an injectable formulation, such as most GLP-1 agonists. Patient preference and adherence to the chosen treatment are essential for successful management. GLP-1 agonists are known to promote weight loss, which can be a significant advantage for patients with diabetes who are overweight or obese. SGLT2 inhibitors may also lead to some weight loss. Both SGLT2 inhibitors and GLP-1 agonists have demonstrated cardiovascular benefits in clinical trials. This can be a crucial consideration, especially for patients with risk factors for cardiovascular disease. Both drug classes have shown renal protective effects, making them suitable choices for patients with diabetes and kidney disease. Common side effects of SGLT2 inhibitors include an increased risk of UTI and genital mycotic infections. Common side effects of GLP-1 agonists include gastrointestinal symptoms like nausea, bloating, and fullness, particularly when starting the medication. Some patients may experience injection site reactions. Be aware of any contraindications or precautions associated with each drug class. For example, GLP-1 agonists are generally avoided in patients with a history of pancreatitis or those with a family history of MEN type 1 syndrome or medullary thyroid cancer.